I like to talk about coronary artery disease or coronary atherosclerosis, and I feel strongly about educating the public regarding this disease. I cannot tell you how many times I have seen patients in the emergency room where a typical chest pain was misdiagnosed, or the patient underestimated the seriousness of his problem. I have seen people with indigestion symptom for 7 or 8 days, or sometimes for several weeks, and the patient ignored it. And it is partly related to the fact that we do not educate our patients well about coronary artery disease. Coronary artery disease is unique because it can be a life or death situation. It's not something always you have a second chance. Even in our scheduled routine visit, we like to talk to our patients about what does it mean to have a chest pain. Chest pain is incredibly common. Of course, not every chest pain is a heart attack or angina. However, it is such a serious problem which cannot be ignored. So we like always our patient to present early, even if they are not sure if this chest pain has any meaning or not. We like to talk to them about that whenever they had the chance. These days, we have a lot of ways of diagnosing the disease early, of referring them to cardiologists for stent placement if they have significant obstructive coronary artery disease. And very few patients nowadays end up having bypass surgery because we have done so much advances in the field of coronary artery stenting, so not many people now require that. But it is essential that we prevent heart attacks from happening, because the damage caused by heart attack can be irreversible and it may not always respond to management. So it is important for us to seek an early diagnosis of coronary artery disease, because now it is treatable. The earlier you treat, the better the result obviously is. Come to your doctor early when you have a chest pain, even if you think it is just indigestion, especially if you have some what we call risk factors for coronary artery disease. Some people are very healthy and they don't have family history, they don't smoke, they don't drink, they're not overweight, they don't have high blood pressure or don't have a high cholesterol. So these people obviously have very low risk profile for coronary artery disease. They shouldn't always worry about any chest discomfort maybe. However, if you have more than 1 or 2 risk factors for coronary artery disease, you should be aware that this increases your chance of having cardiac problem. It is important to be aware of your risk factor profile and to try to modify them and try to go to your physician whenever you have a problem, rather than wait unnecessarily.